In Asia, someone attempts suicide every 40 seconds while 70% never seek help. Why does this happen? It is mainly because of three reasons that AIMO attempts to solve: cost, accessibility, and cultural stigmatization. Stigmatization and these factors are silent killers that block people from getting the treatments that they need in hand. Traditional therapy is an expensive and intimidating process. However, think of being just able to use your smartphone in your room in an accessible and private way to check your mental health. The solution I want to present is to solve this problem instantly by analyzing the user's smart device metrics to calculate your recent mental health status as an AIMO score anytime, anywhere. AIMO tries to create an accessible and easy way for people to check their mental conditions to have a more secure and happy life. AIMO could indeed help people and save them to some extent. Key statistics show mental disorders ranked as the 8th most significant disease burden in Asia in 2019, contributing to 5% of total disability-adjusted life years. Cases increased dramatically from 377 million in 1990 to 555 million in 2019. The burden peaks at ages 30 to 34 years, particularly affecting working-age populations with a higher prevalence among females than males. The triangle of silence poses a significant issue. 1. Cultural stigmatization leads to 50.8% of people fear judgments that they will receive even by the most simple action of visiting a professional. 2. The harsh, deeply distorted system of professional access has less than 5 therapists per 100K. Lastly, the cost barrier is nearly a month saving of $60 to $90 weekly. Your data never leaves your phone. Just follow these 4 steps. Download, scan, and receive your score and recommendations. After each assessment, AIMO provides feedback, wellness resources, direct connections, community support, and crisis helpline. The AIMO algorithm will provide a score-based result to the user by considering media device data, search history, and message and social data to the proportion displayed on the presentation. Our goal is mainly fourfold. 1. Provide an instant analysis instead of lengthy and time-consuming processes. Would you prefer 2 or more hours to receive your result or a 5-minute one from AIMO? 2. We will use edge computing technology to ensure complete privacy from the users. 3. Accessibility can be achieved by setting a low-cost barrier. Then, ultimately, it is to provide an AI-powered assessment that is accurate to the greatest extent possible and is culturally adapted to today's digital realm. Some key market segments are closely related to disorders, age groups, and services. Depression holds the largest market share due to its high prevalence globally. Adults are the largest segment, driven by the high prevalence of stress, depression, and anxiety related to work, family, and life transitions. This group also has higher access to digital health solutions available to the public. In addition, inpatient hospital treatment services dominate the market due to their role in providing intensive care for severe mental health conditions, which is often hampered, once again, for access due to the stigmatization that exists in today's society. Our monetization strategy is simple. A single test will cost $4.99, a package consisting of 2 tests will be $7.99, and the annual subscription will cost $29.99. We will run the system of freemium access where we advertise and incentivize the audience with the app's basic features, such as providing information for local clinics, news supplements, sports centers, and pharmaceuticals. More specific milestones are as follows. The beta launch will be by the second quarter of 2025, the full release will be in the third quarter, and corporate partnerships will be the focus of the last quarter. In 2026, we target regional expansion. The role of team members and what HR we need in the future as a corporation and group will be highlighted in the areas of AI and ML, mental health, app development, and Asia markets. For the investments and vision, we want to break down the funds into AI model refinement, user acquisition, regional adaptation, and clinical validation with the percentages set on the slides. We want to make mental health support as accessible as checking your phone. Thank you. This was AIMO.